can't help asking this. So I give you a lamp with a genie installed, and you get 3 wishes that would really close this health equity gap. And you know what? You choose. Answer it either from the viewpoint of healthcare delivery. You run a big hospital or a large system. What would you wish for that system? Or from larger social perspective, what would be the biggest leverage we could get?
It's a good question. I served on the commission that actually addressed that question.
I know.
And reported that the single biggest thing we could do in the United States is to ensure healthy development of every child. And investing in early childhood, particularly birth through 3. We tend to, when we even think about early childhood, we tend to think of ages 4 and 5. And the processes that shape childhood development and affect health begins earlier. So I think that is certainly one big area, but it's not the only one. I would also say that I think we need to put more health into healthcare. What do I mean by that? Many patients who come into a healthcare context are coming with a range of social challenges that they face. And if all we do is provide them health care and not address the problems that made them sick in the first place and send them back to the same environments that made them sick in the first place, we have delivered good health care, but we haven't had a long-term positive impact. So there are models and there are multiple conversations, multiple examples in the United States of programs that are, as part of the healthcare encounter, linking a client, linking a patient, not only to good medical care, but to social services that might help them address some of the challenges they face. And we know that if we do that, we might keep some of those people from coming back into the healthcare system, back into the emergency room within 30 days, if we can in fact link them with the social service. I think that's one other strategy. And the third thing I would say is strengthening education, which would prepare individuals for successful employment and career advancement is important. Maslow, many years ago, taught us about a hierarchy of needs. Mm-hmm. And if people's basic needs are not met, they don't worry about the higher order needs. And many of the things that we want individuals to do, to get regular exercise, to not smoke cigarettes. If tobacco is the crutch that helps people make it through the day, and some of my own work and the work of others have shown that smokers have higher levels of stress than psychosocial stressors than non-smokers, and that if you intervene on the stress or underlying depression that they face, you enable them to quit at higher rates.
Really?
Yes. So again, trying to take in a big picture and trying to address some of the social challenges that individuals face will put them in a position when they can act to make steps to improve their health.